And so look at this. This is a beautiful example of that undulating endomyometrial junction. Now, it may be a little exaggerated because the tumor is trying to fill up these undulations, but you can see that there's nice, normal, benign endometrium underneath it, a little rim of endometrial stroma. It allows you to see that this is indeed non-invasive, but look at the undulation there. And you can imagine if this is tangentially sectioned, that's very difficult. Here's something that we often don't like to think about, and that is tumor-involving adenomyosis. And that's obviously what's going on here, right? Because you have what I would call a normal gland here. You have a little bit of stroma. It's got a nice, well-circumscribed contour. But we're going to talk about that in a minute. What I want you to focus on for the time being is this muscle. Look at the muscle. The myometrial muscle is large fascicles of well-formed, organized, smooth muscle. And that's a definition that we often forget that we know. We know that. We knew that in histology in medical school, right? But we forget that. And the reason that I want you to focus on this is because when we talk about this fibromuscular metaplasia that can be so difficult, it's the way that you can discern whether this is fibromuscular metaplasia versus myometrium. And so these are the tumors that either in biopsy or in the hysterectomy, they're the big polyps. And you look at the polyps and you say, well, gee, you know there's a lot of smooth muscle stroma in between these nests of malignant epithelium. I bet it's pulled up some of that endometrium and this is actually indicative of invasion. But you'd actually be mistaken. And if you look at it, you'll notice that these are wispy, kind of arborizing bundles. You know, Dr. Goldblum's looking at this going, well, that kind of looks like one of those juvenile polyps with the arborizing smooth muscle that goes up into the polyp. There's a lot of analogies you can draw in different sites throughout the body. Well, that's what these tumors do, is these large polyps, they develop this fibromuscular metaplasia. It looks just like smooth muscle, stains like smooth muscle, but it's not well organized. It's not making fascicles. And this is not true invasion. So when you see that in a biopsy, this is why we don't diagnose invasion on biopsies. And when you see it in a big polyp, this is why it's probably not invasive in that case.